Hello and welcome everyone tonight. My name is Trina Becker and this is Beth Bergstrom, and we are your speech therapy PD presenters for today's EPIC course on Gestalt language processing. Before we get started with the presentation, there are a few items that I need to alert you to. The course is 60 minutes or 0.1 ASHA CEUs. Disclosures for tonight's presentation. Our financial disclosures for this course include intellectual property rights and royalties from products sold on the B&B SLP Teachers Pay Teachers store and our BB Boutique SLP website. We do not have any relevant non-financial relationships for the content on tonight's course. If you have questions throughout our presentation, please write them in the chat box and we will address them at the end. And this concludes our introductory material, so we're ready to start. As I mentioned, my name is Trina Becker, and this is Beth Bergstrom. We both teach at Eastern Illinois University, and we are instructors and clinical supervisors in the Department of Communication Disorders and Sciences. We both love to share our passion about our profession through presentation, social media, and through creating resources for SLPs. Tonight, we will be presenting an EPIC case study on expressive pragmatic language therapy for a Gestalt language learner.
All right. This is our 8th EPIC case study. So it'll be an hour-long presentation on how to arrive at the most appropriate client-specific intervention. Okay. We are going to just talk about a few of these objectives. We hope that at the end of this, you'll be able to kind of analyze a case history and develop a profile of some strengths and needs, and then use all of that information to determine the most effective treatment approach. We have adapted our EPIC form from the ICF framework that ASHA provides to us on their website and from the World Health Organization. So we've just adapted it slightly, and this is what we use to talk about etiology, profile, the impact, and finally the client-specific goals. Again, our topic tonight is a Gestalt language learner. Our client is Jackson, a 7-year, 6-month-old male, and his mom's biggest complaint kind of initially and throughout was difficulty expressing himself. Looking at his etiology, we're going to talk about when he first came to us. Some of the medical and developmental history includes things like retractions at birth due to respiratory distress, ear infections. Mom reports that he snores and doesn't sleep through the night. He does take iron supplements. He is delayed in his expressive language, and this can result in behavior when he gets frustrated, so he is aware. Sensory, he has some overstimulation. He can be easily overstimulated. He yells at some loud noises. He prefers crunchy foods. Mom calls him a picky eater. His diagnoses include a medical diagnosis of ASD, level 2, sensory processing disorder, dyspraxia, hypertonia, exotropia, and astigmatism. He has a history of using an AAC device with touch chat word power 42. He has had other therapies, and other professionals include early intervention services for OT, developmental therapy, and speech therapy. At the time that he was getting those services, because of his age, he was getting those through teletherapy. He started speech therapy treatment at our university clinic when he was 3 years, 10 months. He has an IEP at his school currently, and he gets OT and speech, reading with para support for science and social studies. So to summarize the key findings from his etiology when he first came to us, I think the most important things to highlight are his ASD diagnosis, sensory processing disorder, the dyspraxia. At the time, he just wasn't really doing a lot of talking, so dyspraxia was a little bit of a catch-all, possibly. And then he had a long history of speech therapy and other services. His initial assessment when he first came in was a significant expressive language delay with limited progress really being made. He's had a lot of treatment, although remember some teletherapy. And in that traditional therapy approach, he just was not making the progress that we expected. Some clinical impressions were that he had a lot of those kind of pre-linguistic areas that were a problem: lack of eye contact, limited joint and functional play, lack of reciprocal communication, unable to verbally express his wants and needs. He had some sensory dysregulation, which definitely seemed to contribute to our ability to make progress in his therapy. And just at the point that he came in, we just had question marks. We were like, is this a behavior issue? Is this like a discipline issue? We often had mom telling us if we were to push him a little bit too hard. She'd say, we don't tell him no. We don't say no. So we weren't really sure if that was kind of being one of our, barriers. Did he understand our expectations? Were our expectations too high? We didn't know what his ability level was. He wasn't really able to show us. So was it all of those things? Was it one of those things? I think when he initially came to us, we just weren't sure, and we were questioning kind of all of those areas. At age 5, he had a reassessment, and that included an AAC eval. So at that time, he was profiled to be a functional communicator. He was using symbolic language fairly quickly after the introduction of the AAC device. He took to the device very quickly and easily. His analysis of learning style, again at age 5, was that we started to recognize that what we were seeing was someone who was learning through Gestalt language. So with the device that he got, he initially, or very quickly, I should say, increased overall engagement. Joint play increased, functional play, which gave us so many more opportunities in therapy. With the introduction of models and scripts, now knowing that he was a Gestalt language learner, we also had increases in joint play, functional play, reciprocal communication, and expressive vocab. So just understanding his analysis or his learning style, and also adding that AAC device to give him a way to not be so frustrated, we started to see more progress.
So then I got Jackson at age 7. So it was about a year and a half after that previous assessment. So this is kind of a fun one because we both got to see this client at different points in his development. So we did an informal assessment through observation of play and analysis of his language through a language sample. So he was still not really a child that was going to sit down and do any kind of standardized assessment. So we did this informally just during his therapy session. And based on that information and some information from Beth's previous reports, we came to the conclusion that he does have an expressive language disorder and pragmatic language disorder. At this time, at age 7, he was in stage 4 of Gestalt language learning. So he was beginning to use original phrases and beginning sentences to communicate. And he still had some Gestalts that he was using, but not near as many as he did when he first started with Beth. He had an inability to expressively use vocabulary and grammatically correct sentences. So he was kind of limited in the vocabulary expressively, and his sentences were pretty immature, and he had difficulty answering questions. So when Beth had him the semester right before I did, they were just starting to explore answering questions and trying to figure out why he couldn't answer a question. Does he not understand the back and forth? Does he not have the content? What was the underlying issue there? And then pragmatically, he had difficulty understanding conversational turn taking, joint play, and appropriately initiating interactions. So he had some good play with adults at that time, but he still didn't like us to really join in and mess with what he wanted to do with the toys. He had a little bit of repetitive play, but he also had some pretend play that he was doing. So we really wanted to kind of encourage that joint play a little bit more.
I think the thing that stands out here too is that we felt like we needed to get some of that question and answer. And as we were just kind of learning more about how to approach these Gestalt language processors, we felt like we wanted to be cautious with asking too many questions and doing a lot of modeling. But at this point, he was at a level where we felt like we needed to introduce and model questions and responses. So it was something that we were kind of exploring to push him past another level, really.
And it was hard to know what he knew.
Yeah.
Because we weren't asking him a lot of questions. We were really trying to stimulate that expressive language, but it was really hard to get at what he knew. And even in school, They asked questions all the time and he
Yeah.
had difficulty doing it. So definitely something we were concerned with. So impact errors overall, delayed expressive language was one of the main areas we were concerned about. His social skills, as we've kind of described with his social skills and play and interacting with others. And do you want to talk about sensory and behavior?
Yeah, I mean, from the very beginning, we felt like he had learned some bad habits with his behavior that we felt like was impacting his ability to learn in different environments. So some of them were more sensory related, like he was choosing to do some different sensory play that also kind of impacted our learning. And we had to be a little bit cautious about not just removing all of those sensory needs, but kind of shaping them into something that was more appropriate for play.
And he still would shut down occasionally.
He would, and he still wanted to do some isolated play, as you mentioned before. So he would sometimes take the toy he wanted and kind of go, and that behavior certainly impacted us being able to do 45 minutes of therapy. Yeah.
So his needs, what do we need to address with him? Again, we're thinking about this client-specific intervention. We need to figure out what does Jackson need at this point in his development, in language development, also participation in the classroom and social with his peers. So he needs consistent functional and social communication, specifically for answering and asking questions, initiating interactions, and participating with those peers. His biggest obstacle at this point was consistent teaching by all professionals.
Yeah.
We were at our university clinic, that's what I mean by we were doing teaching methodology specific to his Gestalt language learning, and he was learning quickly once we switched to that.
Yeah.
But he wasn't getting that across all environments, and behavioral expectations across environments were also a concern.
Both at home and at school in the
And
classroom.
at school. So that was kind of a challenge for us, and being able to communicate with the school and sharing information with mom. Mom kind of learned throughout time with you and then with me about his learning style and was starting to get it, but she still had behavior. It was still like, don't tell him no.
Yeah. And he had a lot of people in his life, like in and out of his life, that also kind of impacted behaviors in some ways. And all of the people that were involved were thinking about behavior in a different way as well. So as far as trying to educate everyone, it was kind of a lot to try to manage that. And again, we kind of are lucky to be in our clinic that we have access to those parents to kind of talk about that. But in this particular case, it was still kind of hard because there were just so many different people involved in bringing him and picking him up and and opinions about what he was using with his device and everything.
A lot. Strengths. He does have some pretty good strengths. His receptive language is definitely higher than his expressive. He has pretty good joint attention, and pretend play was such a strength for him.
He developed all those things
He did.
in a couple of years.
Yeah. Well, when you first had him, you talked about the significant delays in those areas, and now I'm talking about them as a strength.
Yeah.
And motivation to interact with adults. He wanted to interact with those clinicians in therapy for the most part.
Yeah.
He had his moments where he pulled away and wanted to do his own thing, but these were all strengths, especially, in thinking about his autism diagnosis. We wouldn't suspect some of these would be strengths for him, but they are, and that's a topic for a different time.
Yes. Okay, I'm going to go all the way back here to our EPIC case form. And this is kind of the time where we like to say, okay, let's make sure that we're thinking about him globally. Let's make sure we're thinking about all of the impacts here. So as you being the one who was working with him while we're talking about his present day, is auditory comprehension a concern?
No.
Okay, so nothing that you're writing goals for, okay? Oral expression.
Definitely.
Okay. EF and cognitive.
Not at this time. We weren't really focusing on that.
Okay. Speech.
Indirectly. He has some jargon that he uses. We haven't talked about that yet. Some jargon that's somewhat unintelligible. You're not quite sure what he is saying. But we're targeting that more through his expressive language, if that makes sense.
Not targeting specific phonemes or talking. Yeah. Okay. Social.
Yes. Concern, impact.
Okay. And something that you're addressing.
Yes.
Behavior,
Yes.
sensory,
Yes.
written expression.
Not at this time.
Okay. And reading comprehension.
Not at this time.
Okay. The only thing I can think about with writing and reading is that he liked to use his device to get out of doing some things at school. And what he would do instead of doing the lesson was to write words on his iPad. Remember when he would do that?
No, I don't really.
And people were so impressed that he was like spelling some of those sight words and things that they'd let him get out of what he was doing in the classroom and just write on his device. So the impact, you just want to make sure that you're asking yourself those questions and saying, is this a concern right now that I plan to address with goals right now, or something I want to think about later? But we really like this idea of walking yourself through each of those questions.
And thinking about what the biggest impact is right now, for sure.
Okay. So, considering all of those impact areas, we want to move into the part where we talk about client-specific intervention and talk about frameworks for intervention. One of the first kind of frameworks that we came upon with Jackson that we thought was really important was some kind of framework that really hit and considered the development of engagement and regulation so that we could improve his social development. We knew that this was an area that he was delayed in. He hadn't had a lot of experience doing these things because he could not communicate like his peers. So we found the Jasper model that we used as our framework, and it talks about ways to improve joint attention, symbolic play, overall engagement, and regulation. So from the Jasper Model resource book, I put here on the title and the authors and just gave you a little sample. They have some targets that they collect through a space data collection. So you can see there on this sample that you're looking at things like joint engagement, regulation, joint attention skills, requesting skills, and language skills. What this does as a framework is it breaks everything down into very measurable skills, which is really good for our clinicians here in the clinic. But honestly, it made me think about things that I had not considered. I don't want to ask him to do the requesting skill if he doesn't even have, the joint attention skill first. So I like it kind of as not necessarily a hierarchy of skills, but I need to make sure that I am considering all of them as a package.
Right.
So this is an example of that. It's a really useful resource manual that I use for so many clients now.
And I think, let me go back for 1 second. I think when you introduced the AAC device as a way for him to have expressive language because he was using so much jargon and wasn't being effective at all, this helps you also consider, okay, I have to develop these things along with introduction of the device to him. I can't forget about those pre-linguistic skills because they're going to develop along with that expressive language piece. So I think this is also a good reminder of that as well.
And, this is not the first time that we have said we feel like the introduction of an AAC device almost instantly improves joint attention because they have a purpose. They have something that they can actually say to another person as a communicative intent that they never had before. So we really feel strongly about, making sure that you're thinking about joint attention. But you can see here that before you can even have joint attention, you need to be thinking about joint engagement and what that looks like, and also regulation. So, even the joint engagement, we're starting to break it down into things like initiating and responding. So I think we have a couple of slides on that as well. Okay. The other framework that we use to kind of focus on Jackson's intervention. No, I was just introducing it for you.
Is to think about his Gestalt language learning. And if you've looked into that much, I'm sure you've heard about natural, language acquisition and considering those stages as a framework for what you're going to be doing in therapy, what goals you're going to write, what's the progression of how you should move through those stages so that you're writing appropriate goals and targeting them in a hierarchy. So stage 1 for the natural language acquisition is echolalia. So processing of language gestalts heard in one situation and used later to communicate in another situation. So at this point, you're trying to figure out what they're using their gestalts for. So they're using this echolalia. You're starting to play detective and, okay, why are they using this phrase? What does it have to do with in this context? How are they using it? Why are they using it? So that you can move then to stage 2 and try to mitigate those gestalts. So at that point, you're trying to you've got those gestalts established, and you're trying to mitigate them and change them slightly to introduce some more functional phrases.
Yes.
You want to add anything there?
I was just going to say, I feel like stage 1, I kind of had Jackson through stage 1 and stage 2, and then he kind of got to a level of 3 and even starting to work a little bit on 4. Again, we've been told over and over again, Gestalt language processing is not a new concept. This has always been around, but it's really thinking about what is the way that your client learns. And so I think recognizing that, and then also recognizing his echolalia as something that was meaningful in the moment so that I could acknowledge it and say, I know you're telling me something. Wait right here. Let me go ask your mom, what she thinks this is or where it came from. So I think that's probably the biggest learning that we did. We just started to dig in a little bit to it. I think we just took it for granted before and didn't think about it. So I think that's what talking about Gestalt language processing and learners now is so important, is that you're starting to kind of tear this apart a little bit and say, what stage is my client in? What are they doing that is actually meaningful? And how can I move that up in stage?
Right. And so you're not at stage 1 and we're just beginning with them introducing single words, right? Because that's analytic. So recognizing that he learns this way is so important in how you set up your therapy session, how you're doing your methods, and also the goals that you're selecting. We're not asking him to name animals, right? We're not asking him to name common objects, which might be a goal that you would address with the child with expressive language. This is a different framework that meets his learning style. This is just a quick little snapshot that looks at stages of natural language acquisition and provides some descriptions of what the 6 stages are, how you might use them. And then on this side, it provides some, I need to move my thing, what kind of supports that you're going to provide that child during those stages. So in stage 1, you're really following the child's lead and play. You're acknowledging all their communication modes. You're trying to determine what the child might be communicating to you. So non-literally, what's the meaning behind what they're saying? And then you're modeling new language gestalts for them. So again, not just single words, you're modeling in entire phrases, entire chunks, because that's how they're going to use their language, or that's how they're going to learn their language. In stage 2, when you're doing the mitigations, you're listening and modeling options for mitigations that can be used in other contexts. So you might insert a word, you might change the end of their Gestalt phrase that they're using to make it more functional for them. You're providing and seeking out experiences as opportunities to model mitigations with multiple communication partners. And I think that's really important too. So getting out of that therapy room and doing that with more people. Stage 3, isolated single words. And so at this point, you're acknowledging single words that the child isolates and you're modeling a variety of 2-word combinations for them, not really focusing big time on grammar or word order. At this point, you're just starting to pull apart those gestalts even more in single and 2-word phrases so that they can start with stage 4, where they're going to use some original phrases and combining those single words or even two words in different ways to make different kinds of sentences. So at stage 4, you're supporting and modeling short phrases that express semantic relationships. You're using grammar for them and modeling that for them and trying to really develop those higher level linguistic and grammatical skills. And then 5 and 6, they're on to original sentences. So they're starting to use more complex grammar here, and you're just going to continue to develop the complexity.
Okay. So what we have now, we have a few videos to kind of demonstrate a few of the levels that we have gone through with Jackson. And then what I have included on the side are kind of highlights, but also some goals. Sometimes it's helpful to see how we might write the goals for what we're trying to do through Gestalt language. What you're going to see in this video, you're going to see him use his AAC device still, some. You're going to see us model some scripts. You're going to hear some jargon. You're going to hear maybe, from that echolalia stage, you might hear some of that as well. We also get to some of the mitigation where I think we use carrier phrases for him, to try to generalize some of those things with some new words. So I want to start with the first goal that I'm going to show you is given a script, and we always did our script for 5 opportunities. We wanted the client to use or imitate. I always have a hard time with knowing which word I want to use as my verb, use or imitate. So I put them both in. Gestalt phrase of the target script after a model. Jackson, this was the first semester that we started using these scripts, and we had scripts for bus, for barn play, and for the sensory room that we have here. So I'm going to first show you him on the floor with the barn, and you'll hear the clinician reading her script as they play with the barn. Does it say 10:45?
Yes.
Okay.
Yeah, it's just, oh, yeah, me too.
There he is.
Jackson. All right, wake up the animals. Open it up. Wake up the animals. Wake up, cow. Wake up the cow. Wake up, horse. Wake up, pig. Let's play outside. Let's play outside. Run, cow. Run, cow. Run, horse. Run, pig. I'm tired. Let's go to bed.
Go kiss it up.
Good night, cow.
We're not going.
Good night, horse. Good night, horse. Wait, that's outside. You can put him in bed. Can you put the horse to bed?
That's a bad
Because that's outside. We need to put him inside to go to bed. How about in there? You want to put him in there to go to bed? All right. Good night, horse. Good night, pig. Say good night, pig.
This is it.
Good night, Farmer Jackson.
This was his favorite part. He wanted to say wake up really bad right now.
Wake up!
Okay, the other really cool thing that you're watching here, if you look over to the left again at some of the goals, is that given a target play scenario, he's going to participate in shared play. And we used a rating scale of like less than half the time, or more than half the time. I mean, here you can see that he was sharing play, which is one of our framework goals, is that we need to make sure that we're working on this joint engagement, shared play as well. And he was doing it. I mean, he never walked away. He never when he went under the table, he was laying down to sleep. And then he finally did his wake up. So again, this is one of the first times that we introduced these play scripts. And so she would read that play script at least 5 times from beginning to end. The first time she might kind of go through it without too many pauses, but he still did imitate or use those phrases from the script as they were said by her, modeled by her. And then later in the next subsequent kinds of times that they went through it, she might pause a little bit more to see if he would fill in more of the script. So you also, did you want to make a
I just
comment?
wanted to say that I love your rating scale
Oh, okay.
and how
Thanks.
you were measuring that goal. I think
Thanks.
that's good to see.
I also just put a little blurb here about, you could hear his jargon. You know, what is jargon? It's a string of sounds and conversational intonation, with or without intent or meaning. But I really feel like he was being very intentional with his jargon. However, it was unintelligible. So, you know, we really were kind of hoping overall that he would increase the occurrence of meaningful, and I might say intelligible, jargon for intended communicative intent. One other kind of interesting thing to see here is, again, how we were still using the AAC device along with verbal speech as we were kind of working on these goals. And so we started to work on some carrier phrases using his device. This seems like yesterday.
I think I remember you pulling me down. To
I
do this
did. I
to
got
watch
so
this.
excited, and I did. It seems like yesterday. Okay, here he is doing some requesting, but using a carrier phrase. Oh, for Pete's sake. I just can't quite get it right tonight. 31.
Wait.
I
Listen.
want
Want. That. Good, Jackson. You're gonna have a big track if you keep doing this. All right. Wait, can you show me? Show me that you want it. I. Good.
want
That. Good, Jackson. Wait, nope. Can you tell me you want it? You want to tell me? I want that. Good, Jackson. Want that. Good
Combination
job.
of using just the device, but also
How does that
using
one
phrase. If you were to skip pushing buttons and just say, I want
Just
that,
on that one, do you
and
think?
accept it and love that.
You're the
But I
builder.
just think it's kind of nice to see how practicing those carrier phrases is really beneficial for communication. And this also kind of shows you more of that
That one doesn't fit as much?
interaction.
Wanna try that one?
Initiating on his own. Well, saying, what do you want?
But she also did a great job taking the cues,
Yeah.
right? She was prompting him and then she backed off and he did it. And I think about how it helped his intelligibility of speech. He was repeating it and with the device.
That. Good, Jackson. I want that.
I mean, at this point, he's such a different kid.
Ooh, we
I
can
mean,
go.
there's so much motivation.
Wait, oh, sorry. Want to do it one more time?
To interact.
Want that. Yes, good job. Making a loop. I
As you continued to work on that, did he start to do the phrase spontaneously?
Yes.
Verbally?
Yes. But look, he just kept on going. All right.
And what I also love is that he's not grab. I mean, he did try
At
to kind of
first.
go over and grab, but then he was like, oh, I know how to get this.
I know.
I don't have to grab it. He had no problems asking for it every single time.
No, he
That
stayed
was-
very motivated
That was interesting
to
too.
do it. Yeah. He liked he felt successful.
Mm-hmm.
Yeah.
Okay, so you saw Jackson when he was a little bit younger. What stage would you say he was in? Natural language
I
acquisition.
think we were at 2 with maybe just a little bit of spontaneous stuff coming out for
Mhm.
3, but mostly 2.
So this next part, when we talk about the goal areas, we're kind of back now to when he was age 7. When I got him, inherited him from Beth because she couldn't supervise in that semester, so I happily took this little guy. And at this point, he was having difficulty answering and asking the questions. I remember again talking to Beth about, or even his previous clinician, like we just can't figure out why can't he answer a question? Does he not know what a what, who, where question is? Is that the problem? Does he not have the vocabulary to be able to answer the question? Do we need to really target the vocabulary? Does he just not get the back and forth because we've been doing so much modeling of phrases that he's just been repeating? So we kind of dug in a little bit to that, but definitely still a main concern for him. And we wanted to continue with his play-based therapy and social interaction to continue to expand and improve his play skills, his initiation with his partners during play, and just having him let us into his play sometimes. I mean, you saw some pretty good joint play there, but there are times that he does not want you to touch what he has out on the table and he wants to do his own thing with that. So we wanted to continue to do that. That was also a priority for Mom. He has a younger sister and she really wanted him to be able to play with her together. So that was a goal for Mom too. And then his Gestalt phrases, we wanted to, at this point, he was at that stage 4, we wanted to increase the grammatic complexity of his Gestalt phrases, and we wanted to expand so he's communicating more things with his Gestalt phrases and with more communication partners. So those are kind of big picture goal areas for him, and then you'll see our specific goals next.
And as age 7, was he first grade?
He was in first grade.
He was in first grade at this point. Okay.
So, starting to do more structured stuff in the classroom.
And do we remember, I was going to ask.
No, I don't. I'm like,
Do we
do I
remember if he was general education, and then just he didn't have a one-on-one aid that I recall.
No, and he had some pull-out services. I
Yeah.
know for some reading instruction, for sure that was on his IEP. He was getting some pull-out for that.
Okay.
So then for our specific goals for him in his individual therapy sessions, we wanted to work on those questions. So what, who, and what doing questions. And we wanted to do it in routine activities because we know he would benefit from that. We've seen him benefit from that in his previous therapy sessions and the way things were structured, as well as with some visual support. So this was a new skill for him. We had to provide him some visual supports. We're going to talk about that more in the methods, but we actually just kind of wrote that into our goal for him. We also wanted him to demonstrate turn taking during an activity by waiting his turn and allowing his communication partner to participate. Watching those play scripts with that previous clinician, she was narrating things and providing models, but they weren't really sharing so much in the play, right? She was doing a little bit, but not a lot of turn taking.
Yeah.
Even with building the tracks, he was asking and getting, so we need to continue to expand this kind of back and forth. So for individual therapy, and this was in the spring semester, those were the goals that we were working on with him. And we definitely broke down the WH questions more specifically in his therapy plan. And then Beth had him in the summer and she got to do group therapy. So do you want to talk about your goals for him in group?
Yeah. So for group, we had 4 clients and 3 clinicians. So it was a room full. And so it was group therapy with peers. So that's what we focused on. We weren't focusing on really anything that was based on kind of individual language skills. So we wanted to work on engaging in appropriate turn taking with prompts during a game with peers. We played things like Duck Duck Goose and Red Rover and Hot Potato, and
fun.
I couldn't stop smiling the entire time I watched. I wanted to go in, but I had to stay out because I would take over. Client will participate and follow intended rules when prompting during a game. We talked a lot about taking a role, an intended role in a game. So very much what you were saying, he wasn't necessarily taking on the role of maybe the doctor or the patient when we were playing that.
Mm-hmm.
And so we wanted to work on that with his peers and following specific rules. Client will imitate a personal script following a model. So we worked on things. Again, parents always want them to be able to have a conversation. It's their number one request. When they say, what's your biggest concern? They're like, I want to be able to ask them questions and they be able to respond about their day. Or personally, if someone says, what's your name? I want them to be able to respond. How old are you? I want them to be able to respond. So we did personal scripts with our peers and worked on, hi, how are you? How old are you? What's your name? What's your favorite? We did favorites throughout the summer. And then also client will use modeled play scripts during target games. So not only did we do some of those kind of rule turn taking games, but then we played some other games that had, again, those roles associated with it, where someone who is the doctor might say this and someone who is the patient might say this.
Okay, so our methodology then for these goals that we were targeting, both really in what we were doing in individual sessions, and then some of this carries over to what Beth was doing in the summer, is that natural language acquisition approach. So we were following Jackson's lead. We were trying to create natural communication opportunities within those play-based activities. We did establish routines with the play and then embedded opportunities for repetition of those routines. So kind of like what you saw in the video that Beth showed you, they had a specific routine. Well, those kept getting more advanced, but they were still routine. And then we did lots of modeling and faded that to then allow for him to have opportunities. We used those play scripts, as I said. And when we were modeling, we used a lot of I statements. So you want to talk as if you are using, as if the child is talking.
I always
I'm
say
saying that right?
Put words in their mouth. That's my own quote. Put words in their mouth. Yeah.
So you're kind of modeling in a little bit different way than what you would for analytic learners, analytic language learners. And we're going to do some recasting for him because remember, he's at stage 4. So we really want to expand, increase complexity, and start to model that specific use of grammar and syntax for him. During therapy, Jackson needs a lot of visual cues and visual scripts. He benefits from multimodality input, cues, and feedback. And so we're using visual scripts, and we know that those are effective for children with ASD, for social and communicative skills. And we're using video modeling. So Beth is going to show you some use of some video modeling in her group therapy session. We didn't use that so much in our individual therapy sessions, but in group. He also used some pacing boards. You're not going to see a video of that, but you use that a lot with him this semester before I had him.
Yeah, and it's really literally just a piece of paper with lines that make it into squares. And we often would say, tell us and use the squares. And I don't know, it's magic. They take their finger, if they say door and you're like, what about the door? Then they say, I want to open door. I mean, the pacing board gives them a visual representation that they need more words. And it's been very useful for a lot of clients to increase their utterance length.
We didn't use that so much in when I got him, but did that also help with his jargon?
Yes, because it made him think about individual words versus stringing all of those words together.
So yeah, that was kind of a cool outcome from that too. Throughout, we wanted to increase diversity of play routines. So as I said, we're at a more complex level for him. We wanted to continue to add to that complexity and change up those play routines a little bit so he didn't get so stuck on routines. So definitely as we kept doing them, we added some more components to them. We used a visual schedule with Jackson so that he knew expectations during that session. And actually, when he came to me, we let him choose the order
Yes.
of the things, which was so successful for him. The first thing he did is he came in, we had our pictures out of the activities for today. He put them in the order. It gave him some control over that therapy session. And it was magic.
He's always been a kid who really wanted that visual schedule and move it over, move it when it's done, put the toy away when it's done. I can't stress enough how much these kids need to know a beginning and an end, what's coming next, when am I done? So that had started out as something that was really beneficial to him, and it continued to be, and letting him make the choices when he was ready.
Yeah, it worked
really
great.
well.
And then we used a visual timer. So just on an iPad, we had an app of a visual timer. Jackson got to the point that he would set the visual timer, which he loved that like responsibility of doing it. And we didn't have it for the first couple weeks. And it was kind of a disaster with transitions, especially at the end of the therapy session.
Yeah.
That was kind of a mess. But again, this visual timer, I mean, it's magic.
Yeah.
It was magic for him and it really assisted him. You'll see that in the video here.
He really wanted direct instruction. I remember when he would come in with his little bus and he
Yes.
only wanted to play with his bus. And then one day we just said, put your bus in your pocket and you can't take it out until we leave. And he was like, okay. And he really did well with being very direct. Yeah.
Yes, and expectations. And we actually, at the end of that semester, when we did our meeting with mom, we talked to her about the visual timer because transitions are hard for her. And she was getting ready to go into summer. We're like, oh, it's just an app. And he responds so well. And he actually got so used to it. Sometimes when he would want to continue an activity, he would kind of ask and he would go to his timer and we would add a few more minutes
I
to
love
it.
that.
And that was really good. It's showing growth, I think, in his ability to
Yeah, I love that.
do that.
These intervention methods now are kind of related to that framework that we saw in the Jasper model. So just regulation, so that they can initiate, participate, and engage in both social and academic settings. So we really wanted to think about methods that were going to increase overall initiation of requesting and commenting and responding and asking questions, using routines and play, embedding opportunities in that. Were really important. Using those personal and social scripts kind of came from that whole idea. Reduce the sensory distractions to increase engagement. This is something that we learned from group. We've got kids who have some sensory needs. However, if they have the choice, even if they don't feel they need the sensory, they're probably still going to go to the sensory toy, and it becomes a distraction. So when we were with the group, we had to really limit that and just keep an eye on if we felt like we needed to remove them to another room to get their sensory. And then I also think important to start thinking about how to balance imitation and modeling. So you really want to make sure that you are in your methods embedding expectant delays where you want them to initiate and respond. You don't want to just model and not give them any time to initiate, but also starting out, it's important to kind of imitate them. So it's a little bit of a progression. Imitate them, model, and then start letting them initiate their own spontaneous ideas.
Okay, this is Jackson's therapy session. This is about midway through the semester. So at this point, we're working on his questions. So we started with just what questions for him, and then what doing, and then we also are targeting who. And what we did to figure out what we were going to do in therapy is we chose functional vocabulary to target. So we chose food, we chose body parts, we chose I'm blanking on the other ones. We chose people in his family. So you're going to see here that we took little pictures of his family and we made paper dolls out of them so that he would know his family members and use that in play. That was super fun. He loved it. And then we also then developed scripts with these play activities around those specific WH questions and responses with his verbs. So we're doing a little bit more complex in this video. So what questions he started getting, he didn't need any kind of cues for those anymore. But when we started introducing the who questions and what doing, we realized he needed a little bit more support. So you'll see the clinician here use some picture supports for him. You will also see her use recasting to get some more complex utterances.
And this is about 3 semesters after the last video you saw.
Yes.
Wearing red too. What color pants?
Purple.
Purple.
Colors, that was the other vocabulary.
Sissy has a red shirt and purple pants. Now she's ready to play.
Is that a duck?
It's a duck.
The duck is the visual time.
That's a new one. It is a duck. Okay, I'm coming to ring the doorbell. Ding! Sissy, ring the doorbell.
Yeah.
Can I go inside? Sissy went inside. Who went inside?
Answer.
Who went inside?
Answer.
Who? Sissy went inside. Good job. Hey. Grandma's coming. Can I? Grandma, ring the bell. What did Grandma do?
Okay.
What did she ring? What did she do?
And
What did Grandma do? Did she go inside or did she ring the bell? She wants to go riding, but what did Grandma do? Look, Grandma.
go.
Grandma, ring the bell. Okay, let's go inside, Grandma. She wants to go jumping. Jump, 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 jump. Grandma's jumping. Jump,
Come on,
jump.
come on, stop.
Come inside. Grandma's gonna go inside. What did Grandma do?
Oh no, it's
Jackson,
eyes.
Grandma, she went inside. Okay, who else needs to go? Bye, Mommy. Mommy's going in.
Okay, so lots of good things there.
Yeah.
He answered a color spontaneously because he was getting really good at those what questions. So that was really cool to see. And then clinician was constantly recasting to add some more words to his sentences and increase the complexity. She used repetition to repeat the question to give him time again to be able to answer, to give some more time to process. And then when she needed to, she went to those visuals.
And
then
he went to the visuals.
Oh
too.
yeah, he loved
Yeah.
the visuals. He needed them. And then when he still didn't do it, then she might provide a choice for him. And then if he gave the wrong answer, she just modeled the correct thing for him. So he's learning. He learned so much this semester with how to answer questions. It was phenomenal.
Yeah. And again, now think back to his regulation and his joint shared play. That has improved. You can see the improvements in that as well. And this kid is on task for long periods of time at this point.
Absolutely. Yeah. And I love that he gave the clinician a direction with a verb because we had been working on those when he told her jump. And she's like,
Yeah.
oh, you want grandma to jump. So fun.
Good thing grandma's jumping. It's the first thing to go.
Wearing red too.
To do it often. Okay, the last video that we have to show you is a little glimpse of summer group. So you're going to see first, right now you can already see the visual schedule on the whiteboard or whatever smart board up there. You can see that they have a visual schedule for the kids. By the way, I think we had one missing this day. I told you there were 4. There's going to be 1 client missing and 1 bumped his head. So there's only 2 clients in the
They
session.
sound like 5 little monkeys.
I know.
Yes.
I know. You're also going to see us working on personal scripts and play routines, turn taking, participation, and then also through the personal scripts, a lot of supported initiations and responses, which I think is a really important goal.
Beth,
So, yeah.
I'm sorry. All these kids were Gestalt language learners in
Yes.
this group?
Mhm,
Okay.
they were. So the first thing I'm going to show you is just a snippet of the video that we showed of the personal script. Let me get a hold of it here.
Did you start the video first?
Is that what I need to do?
Can't go over it.
Yeah.
So there were 3, but now there's only 2. Okay, so here's just a glimpse. If you look at the smartboard, you're going to see a video of them writing.
You need to go to the bathroom.
What's your name?
First watch. My name is Emma. What's your name? Well, then we're
My
gonna
name's
practice.
Maddie. How old are you?
I'm 22. How old are you? Jackson, are you watching?
I'm 22.
I'm not watching.
What's your favorite animal?
My favorite animal is a dog. What's your favorite animal?
My favorite animal is an elephant.
Okay, so that was just a video of the script that
How
we're
would
going
you-
to practice.
What's your name?
And then I'll show you a part where Jackson is actually doing the script.
My name is Listen.
Hi. What's your name?
Hi,
what's
what's
your
your name?
My name is Maddie.
How old are you?
Say that a little louder.
Hey, what is your name?
What are you?
What's your name?
I'm talking to Jackson right now. I am 22. How old are you?
Purpose.
Are you 22? Are you I'm 7.
Purpose 6. How are you?
I'm 22. What's your
So the
favorite
kids would
animal?
go around and do this script with the other parents in the group and also with the
I
other
don't hear
clinicians
you.
to get
You need to
repeated
go a little
practice
louder.
of asking those. Like I mentioned earlier, I really love the fact that we were working on favorites. I mean, it's a really common thing to ask kids this age. Again, parents want their kids to be able to answer those questions. And favorite is a hard concept for a lot of kids. So we worked on that. It was a lot of fun. Okay, last thing I want to show you is we used a lot of videos. You can see all the fun we were having. This is a video we showed of the next activity that we were going to be doing.
Play along with me.
Playing with A, parent, do. We had a lot of verbs.
Play along with me.
Go around,
Shake, 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 stop.
shaking.
Wiggle, 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 wiggle,
Then
wiggle, wiggle, stop.
We gave the
Shake,
kids
shake,
a
shake,
chance
shake,
to be the leaders. So here you'll see Jackson giving the instructions. It was hard to do with his peer who wanted to kind of do it for him, but
Oh, what is that?
It's learning.
Jackson, why don't you tell us what to
Jackson,
do?
your turn. Where's it?
What should we do?
Yeah.
Up, down. You tell us now.
Up there.
Up,
Where's it?
inside, he kept telling him.
Side. Side.
oh, inside. Okay, ready?
so
Up.
Hey, Jackson.
Ready? You have to go spread out, Olsen, so we can go under. Ready? We're gonna go up. Go under. We're under.
I'm gonna try. One time.
Yay.
Okay, and Jackson
And
ended up
Jackson,
giving
one
instructions
time.
let's let Jackson tell us. Since you got a lot
around
of
and
turns, let's let
shake.
Jackson tell us what
So
to
it
do.
worked out really well.
Can't go over it.
Okay, so just to wrap it up, client-specific intervention. If you have a Gestalt language learner, you need to think about their learning style and incorporate that into your methods. Make sure that you are also considering regulation and attention, and please include play. It's the best way to get all those other goals
Yep.
accomplished, right?
Absolutely.
So we will see if we have just a couple of minutes here for any questions. See if I can make this work. Not having a whole lot of luck. It's supposed to say here. Uh-oh. During stage 3.
Okay, during stage 3 and 4, do you explicitly teach use of articles or is it still generally modeling? I have a student who can self-generate but often omits articles. I think I would model but have some visuals specific to that so that you're drawing his attention to that. That's what I would do.
Yeah, and I honestly, you might consider trying that pacing board that we talked about to show that he is missing a word. I think that recasting idea could, with highlighting that omitted word is something that could really help. But I definitely feel like, in stage 4 and then moving, into 5, you're working on those specific things. So I think you want to specifically target that. Thinking about AAC and GLP, do you use phrases on the device or leave it more as is in the analytic language building? Well, that's a great question. There's no one right answer. We have done it multiple ways here in our clinic. Most recently, I have included in social phrases, depending on what device it is, some of the scripts. So I will do things like commenting, things that they might say. I've put them into some social chat conversation pages.
And there's an EPIC case study on speech therapy PD on AAC and GLP, so check that one out for some more info on that.
Yep. Okay.
How can you tell when a child is ready to understand WH questions? Should they have a certain number of stage 1 or 2 gestalts?
I have no idea.
I
A certain number. I don't think so.
I feel like he has to be able to separate his gestalts, right, to be able to do WH questions.
So
to
have
be able
enough to be able to generalize
I
it
think
to
so.
that. Yeah, I don't think there's a specific number. I think it's going to be a professional judgment on if they have enough to move into being able to
Yeah,
respond.
they have enough language to be able to do that.
Let's see.
That's my clinical opinion.
How do you handle kids getting stuck on I carrier phrases? I want, I need. I think add in the play scenes and the play scripts. Maybe go away from those I carrier phrases for a while because it's so super structured, and what they might be missing is that play. So I think maybe introduce more of the script or play scenario and start modeling that.
And not targeting requesting as much. So if you noticed in the play scripts, we weren't saying, do you want the cow or the pig, Farmer Jackson? It was cow's going night-night and night-night cow and wake up. And so modeling different kind of phrases. Also in the like ringing the doorbell, we didn't say, who do you want to ring the doorbell? We were choosing it, we were doing it. And
so then the responses would not include an I.
Correct.
Yeah.
Okay, we have time for maybe one more question.
Okay. I think we might have gotten most of them. There was one about describing what GLP was, but I think that they probably found that answer as we kept going through the presentation. So I think we might be pretty good. One new message.
Okay.
Well, you're welcome. We're getting lots of thank yous, and you're welcome.
And we want to say thank you for joining us, and we hope to see you soon on our next EPIC case study.
In October.
Yes. Thank you so much.